What if our hiccups never stop? Hiccups are annoying, especially if they can't stop. Hiccups can be your worst enemy if they start torturing you, providing convenience to your body. If they last more than 2 days, occasional hiccups can be a sign of a medical problem. Without your notice, you might go through other severe issues, like continuous vomiting, high blood pressure, or might be a heart attack in the worst-case scenario. There are several misconceptions related to hiccups, like some say, you get it when someone is bitching behind you or if someone remembers you. More the people, more the misconceptions. Hiccups can be as frustrating as your worst nightmare. Even if you get it for a short time, you just tend to lose your mind. What do you think it would lead to if it isn't treated on time? The end of your life, the beginning of new diseases? Is hiccups can be cured by some other medications apart from the one meant for stopping hiccups? Well, I can understand that such questions will come into your mind non-stop. Let me help you figure this out to explain the actual mystery behind non-stop hiccups without risking your life. Number 9. In a rare and scarce condition, chronic hiccups became the only human symptom of heart disease. Cases like these are so small and remote, that they were finally known to occur more than 50 years ago. Number 8. In the worst scenario, you may be required to go to the emergency room if you suffer from hiccups every 4 to 6 seconds continuously for 2 to 3 days. No matter whatever you try, this problems won't be over, according to a case study in the January issue of the American Journal of Emergency Medicine. Number 7. Even if you have no further complaints about your health, you because of hiccups would still suffer from blood pressure issue. That would fluctuate by either being too high or too low, and doctors might do a chest X-ray to find if there are any other internal issues apart from having this continuous hiccups. Doctor particularly in this case would give you a painkiller and other medicine known to reduce singultus, the medical name for hiccups. But if the problems becomes too severe, none of these drugs would help to resolve the existing problem. Number 6. 2 days later, you will be in the emergency room. As an older man with several risk factors for heart disease, diabetes, smoking, and high blood pressure, he was given an electrocardiogram, which showed an abnormal heart rate. Blood tests revealed a high level of protein released when the heart muscle was recently damaged, confirming his diagnosis of a minor heart condition. There has been little reason for doctors to suspect a heart attack, as the patient may experience chest pain, difficulty breathing, pain, and nausea, dizziness, or sweating, or just the chronic habits. But as soon as some people are put on a heart medication, their hiccups would go. Number 5. Dr. Joshua Davenport, a paramedic at St. Luke Roosevelt Hospital in New York City and a lead author of case studies, says that in the worst cases, the person may face no warning signs before having a heart attack due to non-stop hiccups issue. But many people, especially those with diabetes, can have unusual indications of heart problems, she explains. Number 4. Hiccups are less likely to be caused by something as serious as a heart attack unless one has other symptoms. Our case was unique and rare, he admits. As to why heart problems can cause hiccups, Davenport says that when the heart does not get enough oxygen because too little blood flows through the diseased artery, this can irritate the streets, the respiratory tract beneath the heart. Number 3. From time to time, you will see cases of chronic hiccups caused by acid reflux. Persistent hiccups can also be due to a tumor on the head, neck, or lungs, or an infection in the brain or ear, as nerves that go to the diaphragm can start in the mind or neck. The good news is that most hiccups do not last long and are easy to treat. Favorite solution? Spoon of sugar. Number 2. Hiccups can be described as involuntary, medial, spasmodic distortion of the diaphragm and intercostal muscles, leading to sudden stimulation and ending with the sudden closure of the glottis. Hiccups usually occur 4 to 60 minutes per minute. 1. Hiccups are considered persistent if they last longer than 48 hours, and they do not waver if they stay more than a month. In diminished care. 2. If not appropriately managed, hiccups can lead to fatigue, malnutrition, weight loss, and death. Number 1. Hiccups can result from injuries that weaken the phrenic and vagus arteries, sensory and functional neural connections to the glottis and intercostal muscles. Vagus and phrenic nerve irritation, gastric distension. Hope you like this video. Please do share your thoughts in the comments section. Also, promote us to subscribe the channel for more eye-opening facts.